Avoid ginger if you have these health issues. Ginger may have numerous health benefits due to its anti-inflammatory, anti-nausea, and other properties. It may help you lose weight, manage arthritis, reduce menstrual symptoms, and more. Ginger comes from a flowering plant originating in Southeast Asia. It adds flavor to sweet and savory foods and has a range of health benefits. The rhizome, underground part of the stem, is the part commonly used as a spice. It's often called ginger root or, simply, ginger. You can use ginger fresh, dried, powdered, or as an oil or juice. It features in many recipes as well as processed foods, home remedies, and cosmetics. What is ginger? Ginger is a flowering tropical plant that grows in China, India, Africa, the Caribbean, and other warm climates. The root of the ginger plant is well known as a spice and flavoring. It's been a traditional remedy in many cultures for thousands of years. Ginger health benefits. Ginger is a common folk treatment for upset stomach and nausea. There's evidence that it helps. Ginger seems to aid digestion and saliva flow. Studies found that taking ginger could ease nausea and vomiting in some pregnant women. But pregnant women should be careful with ginger. Some experts worry that it could raise the risk of miscarriage, especially in high doses. Ginger seems to help with nausea caused by vertigo as well. There's mixed evidence about whether it helps with nausea caused by motion sickness, surgery, or chemotherapy. Ginger does seem to help with painful periods. In one study, more than 60% of women felt that ginger lessened pain. There's strong evidence that ginger may ease osteoarthritis pain. It may also help with rheumatoid arthritis, muscle and joint pain, headache. Clinical evidence shows evidence that ginger may help lower blood sugar and blood pressure. Some people apply ginger compresses to the skin for pain. Optimal doses of ginger have not been set for any condition. Quality and active ingredients in supplements may vary widely from maker to maker. This makes it very hard to set a standard dose. Ask your doctor for advice. Ginger nutrition. 2 teaspoons of ginger has 4 calories. The root doesn't provide many vitamins or minerals, but it's full of antioxidants that help protect your cells from damage and prevent disease. Ginger natural sources. Ginger is a common spice and added flavoring. Many people drink ginger teas or soft drinks. Ginger is a common ingredient in chai tea. You can also find ginger lollipops, candies, and capsules. May help with weight loss. Ginger may play a role in weight loss. According to studies in humans and animals, ginger supplementation significantly reduced body weight, the waist-hip ratio, and the hip ratio in people with overweight or obesity. Ginger's ability to influence weight loss may be due to certain mechanisms, such as its potential to reduce inflammation. Can help with osteoarthritis. Osteoarthritis, OA, involves degeneration of the joints, leading to symptoms such as joint pain and stiffness. One review concluded that ginger may help reduce pain and disability. The participants took 0.5 to 1 gram of ginger per day for 3 to 12 weeks, depending on the study. Most had a diagnosis of OA of the knee. However, other research has not found evidence of the same effects. However, many discontinued treatment as they did not like the taste of ginger or because it upset their stomach. May lower blood sugar and improve heart disease risk factors. Some research suggests ginger may have anti-diabetic properties. 41 people with type 2 diabetes took 2 grams of ginger powder per day. found a significant reduction in fasting blood sugar and HbA1c in people with type 2 diabetes after taking ginger supplements. The review looked at results from 10 trials, in which participants took 1,200 to 3,000 milligrams mg per day for 8 to 13 weeks. The results did not suggest that ginger supplements affected the lipid profile. A high apolipoprotein B/apolipoprotein AI ratio and high levels of malondialdehyde, MDA, can result from oxidative stress, a byproduct of oxidative stress. They are both risk factors for heart disease. However, this was one small study, and more research is needed to confirm these results. A 2019 review also found evidence that ginger can reduce HbA1c in people with type 2 diabetes, but the authors did not conclude that it can lower fasting blood sugar levels. May help lower cholesterol levels. High levels of LDL, bad cholesterol are linked to an increased risk of heart disease. Ginger consumption significantly reduced triglycerides and LDL cholesterol, while increasing HDL cholesterol. Even doses less than 1,500 milligrams per day were effective. However, it may be hard to include such high doses of ginger in your diet, particularly if you don't like the taste of ginger. Ginger risks and side effects. In small doses, ginger has few side effects. High doses of ginger, more than 5 grams a day, increase the chances of side effects. Ginger on the skin may cause a rash. Eating or drinking it may cause gas, heartburn, upset stomach, mouth irritation. Risks: ginger may raise the risk of bleeding. If you have a bleeding disorder, it may not be safe. Always tell your doctor about herbal medicines you take, including ginger.